All right, welcome everybody. We're gonna give people a minute or two to get settled and get in. I see we have Margaret here. Hi, Margaret, thanks for coming. Matt, Sabrina, Steve, good. And I'll introduce them more in a second, but just so we're not all awkwardly sitting here together, Melora and Sarah are here from Second Wind Dreams. So Matt is from Clinton Township, Michigan. Steve is from Delaware, Ohio, just north of Columbus. Thanks, Steve. Actually, yesterday when you said you were from Delaware, Ohio, I was like, oh yeah, but I looked it up. I didn't know exactly where Delaware was. And Margaret, if you want to share where you're at. Marie, am from the Southeast Michigan area. I'm just outside of Ann Arbor in Detroit. Little town called Milan, Charlotte. Cool. All right, we'll give people just another minute. I got a few emails this morning of people who weren't going to be able to make it. I'll just give another minute. Sabrina, I see that you are on your phone. That's cool. You can still use the chat feature if you have any questions when you're on your phone. I always feel like I need some good elevator music. I have one of my techs is looking into open source music that we can use during some of these quiet times. I'm actually a social worker by training, and so we use silence to get other people to say things. But I find when I'm on these webinars waiting for them to start, I'm the one filling silence. So it's just funny for myself. We're about 2 minutes in, so we are going to get started. This is recorded, so if you have to dip out for a minute or if you need to come back and revisit anything that we shared today, you will be getting that recording after the presentation. Also, if you are a person who weren't able to make it today, you are obviously watching the recording as well. And feel free to share this with any of your friends. This is really good information. Again, my name is Marie. I am the founder of WizeCove, Senior Center Professional Network and Community, where we do education, we do networking. Our big focus for 2021 is reopening sites safely. And as far as cover page goes, our business that owns us, we're going to have a very big focus this year on digital ageism, which we're really excited about. We are here today to meet Second Wind Dreams. They are one of our amazing partners. They do really great work. I'm so excited that they are here to talk with us today and just support some of the work that we do as senior center professionals. Before I introduce them, I just want to let everyone know we do have this chat box. A lot of you have already used it to share where you're from, but if you have any questions, feel free to write that in the chat box and we'll be answering them throughout, but mostly at the end. So with us today from Second Wind Dreams, we have Melora and we have Sarah, and I'll turn it over to you guys to do a much better introduction of yourselves.
Okay. Welcome. I'm Melora Jackson, and I am the Virtual Dementia Tour Clinical Manager for Second Wind Dreams. And I have been a certified trainer with Second Wind Dreams since 2013, and I have been using the Virtual Dementia Tour as a facilitator since 2006. It's been an exciting journey to be with them. And I will let Sarah introduce herself.
My name is Sarah Eckert. I am the Chief Programs Officer here at Second Wind Dreams. Have been thankful to be with the company for just about a year and a half now. I'm not as experienced as Melora with the Virtual Dementia Tour, hence why I rely on her a lot for information absolutely fabulous and an expert in everything she does. We are very grateful to be a partner with WizeCove and be here today to talk a little bit more about what we do at Second Wind Dreams around our Dreams program and most importantly, our virtual dementia tour. So I will be monitoring the chat. So if you have questions, feel free to pop those in there and I'll help respond to those. Otherwise, I'm going to turn it over to Laura for our presentation.
All right. Thank you, Sarah. So Second Wind Dreams was founded by P.K. Bevel, who is a geriatric psychologist, and she founded it in 1997. Actually, if you can move, let's stick with this slide for a second. I'm kind of going to get ahead of myself on some of these slides, so just bear with me. But it was she founded the organization in 1997, and the goal really is to change the perception of aging. Ageism, of course, I'd be preaching to the choir to tell you about how bad it is. But she wanted to fulfill dreams of elders who lived in long-term care. And I'll talk about more of that in a minute. And the virtual dementia tour is something that she started out as a doctoral thesis project in 2001. And it was just something she was doing with one nursing home, and they asked her to come back because they found it so effective in the training. And so that was the beginning of that. As time went on and it became a more honed tool and patented, she donated it to the organization so that proceeds from the sales of Virtual Dementia Tour would go back into the program and help fulfill those dreams. So if you could go to the next slide. So, all right, I've just covered some of this, but one of the big, there's really two main arms of Second Wind Dreams. And the first is the Dreams program. And dreams fall into different categories, but the idea is to explain to the world, to show the world that people are viable and have dreams and are wants and needs at any age. And so she divided these dreams into different categories. So there's adventure dreams, heart and soul dreams, family and love, and reliving the past. So an adventure might be like, as you can see in the picture, the person who's jumping out of a perfectly good airplane, something I would never do, but some people like that. They're just all kinds of amazing things that people have wanted to do. And family and love, reuniting with a relative. Sometimes it's reliving a wedding, redoing the wedding, and it can be a little dream. Something it could be reliving the past. One dream that comes to mind immediately is a gentleman who had lost most of his eyesight, but wanted to. He had been a landscaper, and he wanted to mow the lawn again. So they got a push mower and someone to guide him, and he was able to mow the lawn in front of the nursing home. And for him, that was just huge. And so dreams can be all kinds of different things. And so we've fulfilled over 20,000 dreams, and that number is growing every day, which is exciting, and it's continuing to grow even though we have a pandemic on our hands. So dreams are modified, but they're still happening, and that's really wonderful. So one of the things, because when we tell people about this, it sounds like a lot of fluff. It sounds like, oh, that's really sweet and all that, but what does it really do? So one of the things that happened early on was PK did a research study on the impact of getting these dreams fulfilled and so we've got some good solid data on how it does reduce depression, increase staff morale, and so on and so forth. One of the things that we've added a couple of years ago, our dreams department, we did a little bit of a crossover. One of the things that we have in our virtual dementia tour department is certified trainers, and I'll talk about that more later. But Amy Saffron, who's in charge of the Dreams program, and her and Brenda Reeves have run a magnificent program. But Amy and I got together and we expanded the Dreams program to certified trainers. Normally it was meant for long-term care, assisted living, nursing homes, those kind of things. So to get dreams fulfilled out in the community for elders who are socially isolated, didn't have a lot of social support or things like that. Our certified trainers now have the opportunity to become dream coaches. And so that allows them to fulfill, to work with their communities and businesses and such to fulfill dreams of elders who live in the community. So we've expanded that, which is really exciting. Okay, next slide, please. So also in that department, we have the Gifts of Light program, which is a holiday gifting program. And they focus on nursing homes, and it's primarily in Georgia, but some other states, some of our other Dream members participate in other states as well. And basically, it's a program to get gifts to, and we do deliver on Christmas Eve. And up until this year, the goal was not only to have gifts for all these elders, for whom a lot of them, this was the only gift they get, but to actually have volunteers go in and visit with them, so they'd have some social time with them as well. So not just delivering a gift that's from some anonymous gifter, but to actually spend some time with somebody. This year, of course, we've had to limit that. So gifts had to be delivered and then dispersed, and that's unfortunate, but hopefully that's temporary. Along with that is the Cards of Light program. This is a year-long program which asks volunteers, Dream members, anybody really who wants to participate, to write cards, and they go to elders and sometimes staff too, residents and staff of long-term care facilities. And that can be for any occasion. We do, of course, the major holidays, but also, things like Mother's Day, Father's Day, and so on and so forth. And so that's been a great project for kids, community groups, civic groups, whatever, to be involved with. We've had many senior centers who have, they sit and write, the seniors write cards and send them to a particular contact person that we give them at that particular elder care community, and then they get dispersed accordingly. So it's an opportunity that's great for anyone to participate in. With COVID-19, we last year had a Cards of Light Luminary Challenge, where we really tried to push this hard, because people, of course, are far more isolated than normal, and just had an overwhelming response, thousands upon thousands of cards to go to elders and the staff. We really focused on both, because those staff certainly need to be lifted up as well. So those programs are supported by some of our income streams too, and as well as sponsors, partners, and so on, and a ton of volunteers. All right, next slide, please. Is it not coming up? There we go. Okay. All right. So the virtual dementia tour is the other big half of the organization. And underneath that falls, and it's not really our department, but in conjunction with the virtual dementia tour, we have a grants department which uses the virtual dementia tour to provide training to staff in nursing homes. We have a few small community kind of grant projects around the country, but primarily right now we've been focused on nursing homes thus far. We are growing by leaps and bounds. Things have kind of slowed to a cold drip this year, of course, just like it has for everybody, but that will continue to grow in the future as well. So the virtual dementia tour is an experiential training program to simulate what it's like to have dementia. And the goal of that is to build empathy and improve empathic person-centered care. Now, I made a poll, which there's only 3 attendees online, so I'm going to go ahead and do it anyway, just for grins and giggles, even though there's not that many people to answer it. But the poll was just simply, was just a quick question. I'm just going to share it, and y'all can answer it, to see who's ever experienced the virtual dementia tour before. Out of 3 people, that doesn't give me a whole lot of intel, but still, that's okay. So for those of you watching it, hopefully some of you may have gone through it. My guess is the majority have not.
I've gone through it. I can't take the poll as the host, but I have done it.
Okay, we'll count you as a yes too then. Definitely. So So this simulation of dementia, now there's lots of different simulations of dementia out there, but this is the only one that is scientifically proven. It's evidence-based. It meets all the federal criteria to be evidence-based. We have research. If you're interested in the research behind it, we have a 3-page list of research studies that's growing every. In fact, I had to revise it this week because we added one more person, one more research study. On this tool. So it is patented. It is got, well, let me just explain how it works. It's the easiest way to do it. People take a pre-survey on their attitudes about dementia. They are given, they're grabbed up with some gear that impairs their senses and simulates some of the aspects of dementia. And then they're taken into a room and they're given some things to do, and they're in the room for a certain period of time. Then they come out and they take a post survey on has their attitude changed or not, and then has some additional questions on what they would do differently now that they've experienced this. It is followed by a debrief session. So you don't just go through the tour and not get the debrief, because that would leave a lot of people very confused, and that's not a good idea. So we have people who lead the tour are trained to have this discussion and help connect the dots and help people understand how their own behavior and experience in the tour is like those of people with dementia. And once people walk in the shoes of someone who has dementia, they begin to change their behavior. So instead of focusing on changing the behavior or managing the behavior of the person with dementia, we focus on managing our own behavior and the way we respond to people with dementia and what we do to trigger behaviors and things like that. So it's based on a ton of research, including initially brain scans, interviews with family members, care partners, people in early stages of dementias, a lot of research and looking at MDS data sets in nursing homes, at mini mental status exams, lots of kinds of different things like that. And honed it to really match, as best we can tell, what it's like to have dementia. We both she and I over time have worked with early stage people. I used to run a support group for people in the early stage of dementias. And at one point, one of them, this was a few years back, one of them asked if they could try the headset on, because I had the gear with me because we were going to do a little workshop for their family members, and they wanted to know what it was like. And I said, well, I'm not going to put you through the tour, that wouldn't be right. But they insisted, they want to hear the soundtrack, and they put it on their heads. And they looked at me and they said, how did you know? How did you know this is what it's like? So we knew then we hit the nail on the head. And PK had done that before with some individuals as well and had a similar response. So all of that is how the basic virtual dementia tour is formed. And it has grown over the years. And we've had several million people have gone through the tour, not only in this country, but around the world. So what I would like to do next, and I don't know if we got the video to work in the PowerPoint or if we have to do it separately, but this is a 1 minute or so video that is done by one of our good fortunes is to have a few celebrity contacts. And one of them is Lisa Gibbons, who some of you may know. And she has some day programs for people with dementia in California and South Carolina. She is now a VDT facilitator, but this is a video that they produced that kind of gives you just a snippet taste of what the tour is like and what it's about. So if we go ahead and just play that, and then we'll talk about it. There's only music, there's no words, so don't worry if you don't hear any sound. It's not important. Yeah, that's all there is to that. But it gives you just an idea of what it looks like, and it can be done in a variety of different environments. So that one happens to be in a big meeting room in a adult day program. So we can do it in all kinds of different environments. And PK and I often joke about we can do it out of the trunk of our car if we need to, which is not ideal, but we've done things like that. So that we have as over time things have evolved, and we've developed some additional versions of the virtual dementia tour. So we have the traditional version, which is what I've been talking about so far. And then we've developed in the last few years a few specialized versions and are continuing to develop new ones to meet the needs of specific audiences. So we came up and we have a partner in the UK called Training to Care. And all of their VDT is done in mobile units. So they have specially designed buses that people go into the bus, and that's the experience room that they go into. And they started toying with this idea of an inclusive one. So, and from there it grew. And so now we have worked on developing this further. And so what we have is called the Inclusive Virtual Dementia Tour. And basically what this does is we take people through the traditional VDT and then do a quick debrief, and then we flip it on its head. And we take them into a room, the same room, changed, and we change the environment, and we change the way we do everything. So it becomes a model of good, empathic, person-centered care and how we can do it differently. So not only instead of just in the traditional debrief, we talk to them about what they could change, how they could do things differently, but now we can actually model that for them. So this one takes a lot more time, and it's even more prop intensive. So it's designed to do for smaller groups of people because it takes a lot more time, but is well worth it. So we've been concentrating on doing it for leadership, decision makers, thought leaders, and so on. But it could certainly anybody could participate in that as well. And we also have a hospital version we developed for those who work in hospitals, because I think the public has this general idea that if you work in healthcare, therefore you understand dementia, and that is definitely not true. Most people who work in the hospitals, whether it's doctors, nurses, aides, therapists, phlebotomists, you name it, they don't know about dementia. They know about medical care, but they don't know all those other things. And so this was developed to help hospitals specifically. And so this one is designed to be done in a hospital setting, if at all possible, with tasks and an environment relevant to what it's like for the hospital. So they can get a sense of what that patient is experiencing if they have dementia. And then they can make not only personal changes in their own care behaviors, but also look at some systemic changes that they might be able to make it not only safer, but a more positive experience for the person with dementia, and better for everybody. We also have a family version, and I wish I had brought with me the little box, but we have the family version, which was developed quite a while ago, that comes in a little box, and it looks kind of like one of those catering lunch boxes, but it's designed to look like a house. But the idea is it's a self-directed version that a family member purchases, and then they have all the instructions embedded in an MP3 player, and they just connect their headset, and it has a little dry erase flip book to do all the tasks that we need them to do. And the tasks and the things that we ask them to do are different. They're things that they can easily do in the common areas of their home. And then it includes also a booklet about for them to process that experience, and also some caregiver information as well that's to help them with that. Now, since then, we have developed a family service where a certified trainer can go into the home and do like a half-day consulting session where they go through and they use this version, but the certified trainer is right there with them, and then works with the family as a group to look at what do they need to do differently as a family, and work through some of their issues, and then also how do they need to adjust their environment or their care provision, and resources, and so on and so forth. So all of these different specialized versions can only be done by certified trainers. So the average program holder can't do these require special training. We're also in the process of developing a mealtime version because one of the things in congregate meal situations is it's very difficult for that person with dementia to negotiate that environment, and often they don't eat enough. So whether it's a congregate meal site, it could be in a senior center, or it could be in a nursing home or assisted living, or any kind of group dining experiences. That's the goal of this version. And then we're also working on a version for dental version for when a person goes to the dentist's office. That can be a terrifying experience for a lot of us anyway, especially if you need more than a checkup. And for a person with dementia, it really can be a very traumatic experience when you have no idea what's happening. So that's going to be, obviously that one's for dental office staff. That's not going to be for everybody, but once we've developed those, then we'll move on to the next thing. So we hope to have, adding every year new versions that are specialized to meet the needs of different audiences. So let me backtrack real quick, and then we'll move on to the next piece, but this is important. So with the traditional VDT, we have different ways of doing that. We have what we call the group version. And when a person or organization buys this tool, they get both. They get this group version, so you can do it with people in a group where they rotate in and out, and then they do a group debrief together. We also have what we call a community version, which is designed more for members of the public, caregivers, and whatever. And so in that style, people still come and assign time and they go through the tour, but then they get a one-on-one debriefing. So it's more of a guide, I wouldn't say guidance counseling session, but it's short, but it meets the needs of just what addresses their questions and their issues rather than being a long in-service. So, and that we tend to give people local community resources as well as information about what they could do differently. And the difference between the two is, there's lots of differences, obviously, but the community version includes that individual, that participant, to be able to take home the pre and the post survey that they filled out and the observation sheet, because in both versions, there's somebody in the room watching and observing and taking notes on how they behaved and what they got right and what they didn't. So this version allows them to take the whole booklet and see what did they actually do. And a lot of times we find that the things that people do mirror, if they have a loved one with dementia, we find out that they do the same things in the room that their loved one does. And so it can be very insightful. So we've got some different ways of doing the traditional version to meet the needs of different folks. So, okay, next slide. So one of the tools that we have that is pretty unique is this tool called Dace that PK developed, and we've since honed some. And what it does is it measures empathic person-centered care. It's primarily used in group care settings. We have a handful of hospices and home health that use it as well. But the idea is that an observer will watch the person giving care, and usually it's a direct care worker of some sort, providing personal care to an individual with dementia, and they rate them on these different characteristics. And so what we're able to do, and we do it pre and post training, VDT, it can be also used with other training interventions as well, but obviously we designed it in hopes that it would be used with the virtual dementia tour. And it provides concrete measurable outcomes, because when we talk about person-centered care, we all know what it is when we see it, but when you sit down and try to define it, it gets a little bit more tricky. So it takes all those intangibles and makes them tangible. So it's a great tool for measuring competencies, sensitivity, empathy, dignity, respect, and on and on. And you can get instant feedback. It can be used in many ways. It can be used to compare one shift to another. It can be used to compare an individual to themselves and their own progress. If a person isn't performing well, it can also help people. The user target specific trainings to fix certain areas of person-centered care skills. It can be used in disciplinary ways too, if you need to for documentation as well. So there's lots of different ways that can be used, and primarily it's used in care settings, but we would love to see that branch out more into other ways. Our partners in Italy, we have certain partners, and I should back up real quick and tell you about that. For the virtual dementia tour, if somebody is outside of this country and they want to have the virtual dementia tour, they need to become our partner. So the way we've designed our setup is that one organization gets the exclusive rights to use it for that country, and so we work with them to serve all the populations. But we have a partner in Italy, and they are working on some research to see how we could do Dace with some other professionals besides direct care workers, such as nurses, and in Italy, nurses do direct care as well as nursing. So it's a very different setup. But nurses, doctor visits, PT and OT, counseling, and I think there's another one that they're looking at. So we're looking at some higher level care and medical professionals. I think there's one that's akin to a case manager, social worker type thing. So they're working on some different ways to use the tool with those populations, and of course we'll have the ability to use that too once that's developed. So this ties directly back into the virtual dementia tour, because it gives us a way to measure how effective this is, in addition to all the other research that we do. So we have these grants that I spoke of earlier, nursing home grants primarily, called Civil Monetary Penalty Fund grants. And I think some of you might be familiar with it. I don't know, because you're working in home and community-based settings. But basically, these grants are, just in case you're not familiar with it, the simple version is a nursing home has deficiencies and they get fined. The money goes into a pot in their state. It's a federal program, but each state has their own pot of money. The money goes into the pot, and then that money is granted to different proposals, different projects to improve resident care. So provide training and tools to help that nursing home do better, or any nursing home do better. So basically, it's recycling and fixing the screw ups. In other words, so it's a CMS fund that each state has its own pot, and it's usually it's a division of Medicaid in most states that administrates it. But so we're able to apply and get funds to do these projects in several states, and right now we have 3 active grant projects. We just finished one in Wisconsin, and we've got 3 others, one in Mississippi, and one in Tennessee and Kentucky. Now, we've had to scale these way back, and a lot of things are kind of on hold, and we've made a lot of adaptations to COVID, so things are going real slow with them. But we're excited with the progress we've been able to sort of do a hybrid of part online training and part in-person training. And so a lot of them were sort of circling the wagons, waiting for the go to get back into the nursing homes, which you can imagine is a daunting thing right now. So, but those projects, we've used Dace along with the virtual dementia tour, and we've seen such good data in the past grants we've done and the ones we're doing now, and how we see how it changes that care staff's behavior. And when I say care staff, I don't just mean direct care workers. I mean everybody from the maintenance guy to the director of nursing to the administrator. Everybody participates, because to the person with dementia, we are all the same. They don't care what our role is. They don't care what our job is. They have a certain expectation. And we, whether you're in a group living environment, or you're in a senior center, or a home health service, or whatever, or you work as a bank teller, it doesn't matter. Wherever you work, that person with dementia has certain expectations. We all need to have a basic understanding of what it's like to have dementia, and how we can better interact with that person and help provide supports and meet their needs in whatever our capacity is. So, okay, next slide. So we have a lot of online offerings, some of which we've had before and some we've added because of COVID, because we live in an online world this year. And so we're doing our best at pivoting like everybody else to try to meet people's needs. So one of the first things that we came up with was ways to modify the virtual dementia tour to do it more safely when we do it in person. So we have lots of new safety protocols. We can take fewer people through at once because we do it one at a time. We've got directions for people to self-guard versus putting the equipment on people and various things like that. So we are still able to do it in person, but it's much more limited. But we also have one of the other first things we did was PK and our board president, Jay Bulott, actually put together a training for empathy during COVID on how to provide care in these particular circumstances. So we've got CEs, I believe. Correct me if I'm wrong. Yeah, we do have CEs credits for that course that people can purchase. It's on demand. All of our online trainings are on demand. We don't have, at the moment, live ones. We do have a couple of offerings, the conversations that are facilitated ones that would be live, nutrition counseling. Gwyneth Johnson, who is our CEO, is also a nutritionist, among many other titles, and she does some nutrition counseling, and PK is doing some family consulting live conversations on Zoom with families as well. But the other things are all on demand. And so we have a series of visual imagery tools that people can watch the visual imagery. PK leads them through the visual imagery, and then I do like a debrief interview with several people about that experience, and we attach them so that the person can get, it's about half an hour to 45 minutes for each one of those. And they cover various topics. Like the first one is moving into an elder care community, and another one is experiencing a meal, another is bathing, and so on and so forth. We also have family and care partner videos and resources. We have a whole page that you can go to on our website, excuse me, that has a variety of these offerings that you see above, but also some other things as well. We have several family webinars that they can watch on everything from how to manage during the holidays with your loved one, nutrition, more on caregiver stress management, and a variety of different things. We also have, as you can see in the picture, a little book called Your Window into Their World, and that comes if a family member purchases the family version, that comes with the components. But you can buy that separately as well. And it's basically a little mini caregiver manual. We have a few resources listed in the back, but they're of course at the national level because people are using this all over the place. But it gives some good caregiver tips, even if a person hasn't gone through the tour. We also have for sale these clear face masks, which really can help for a lot of people. If they can't see where the voice is coming from and they have dementia, they don't realize you're talking to them, and it's very hard for them to understand this whole concept of masks. And so that family caregiver or a person working in a long-term care can use them as well. It gives them an opportunity to see the mouth and read the lips, so they get more cueing. That helps a lot. Now, I have heard of some people with dementia, they find that weird and frightening as well. But for the most part, that is a helpful tool. And of course, also with people who are hard of hearing, it's helpful. So we do have those. I think they're like $6 or $8. They're relatively inexpensive. So we have those kinds of offerings. And then we have also, for all of our program holders, all those who have the virtual dementia tour and who can't do it right now because of their circumstances, we're having some online short training videos that are about, I was hoping they'd all be 15 minutes long, but some of them are going to be longer. So hopefully anywhere from 15 minutes to 30 at the most. I'm shooting for 20 minutes. So on those that covered various aspects of dementia, so they can be used by anybody who wants to do some staff training for different aspects of dementia and person-centered care. So those would be available to anybody, to all of our program holders, and there's no additional cost for those, as long as the person is a member. So those are some of the online offerings that we're trying to do right now to help meet those needs, and those will continue after COVID is over. We'll continue to offer these kinds of things, and if you'll go to the next slide. We are now embarking, literally just embarking, like we're getting trained in 2 weeks ourselves to be able to do this. This is like so fresh, so fresh. The ink on the contract is not dry yet, but we're working again with our UK partner who has developed this program called Dementia Interpreters. And this is going to be a program, and Sarah, you can certainly add to what I say, because this is something that we ourselves we're very excited about this offering and how it's going to help us to expand what we can offer people. But it's basically a certification program that certifies you as a dementia interpreter. And there are different levels. So you take different modules, and there's some simulation parts. Well, the virtual dementia tour is a piece of it. There's another simulation, I believe, of other aging disabilities as well. And right now what they're doing in the UK is they're mailing the materials to the participants, and then they use them for those modules, and then they send them back. But the rest of it is online modules. And then there will be forums where people can go in and ask questions if they're caring for somebody with dementia or interacting with them and they have a question, they can do it. And the people who have completed the program can answer the questions and offer advice. And it is, of course, monitored by people with dementia expertise. So it'll be monitored by some of our clinical staff, including myself, and making sure before an answer is given, we have to approve that, basically we have to approve the post, like an admin would be in a social media group. So if somebody's giving bad advice, it never gets out there. So we have some serious clinical control over that. But this will enable people to have a certification that to have something that they can say, this can go on their resume and say, look, I've got some dementia training and competence here in this area. And so that's a great thing. So it should be open to, I think, anybody who wants to sign up for it and register. I can't give you information on the cost, Sarah. You might be able to. I think we're still wickering on that a little bit, but it is, I think, 12 levels?
It's 12 modules, but it's 5 levels. So it's like a module a month type deal. And then once you do a certain number of modules, you move on to and certain things, and you move on to the next level.
Right. And it's self-paced. So if it takes you 2 months to do a module and then to go to the next one, that's fine. If you cram them all out in a week, that's fine too. So it really is something that can work around people's schedules and their needs as well. So that is coming very, very soon. We hope to have that up and running like within the next month or so, hopefully, ideally, knock on wood. So check back with us often if you're interested in that. So that's our program services and the virtual dementia tour in a nutshell. At this point, if we could just take it to that last slide. This is our general contact information. Our offices are in Roswell. So Sabrina, you're right down the road, literally. You could probably, I would say normally pop in and visit us, but right now, maybe not so much. When this is over, you can. But some of our employees are spread across the country, as I understand you all are. I'm on the Mississippi coast, so I'm not actually in the Roswell office, but if you want to get in touch with any of us, this is our contact information, and we're more than happy to answer any questions that you might have. So
while people are typing in their questions, Sabrina is at the Benson Senior Center, and she said that when I announced that Second Wind Dreams was going to be one of our partners, she was like, oh my gosh, I love them. They are right around the corner from us. She's worked with PK in the past, so that was just a really cool networky thing. So I have a couple of questions myself. You talked about the Dream program first. Are dream recipients just people living in nursing homes, assisted livings, or would people at our senior centers and adult day programs be eligible to be dream recipients?
That is a great question, and actually that I'll go ahead and answer that, because that is a group we are looking to expand to. Historically, it has only been in nursing homes and assisted livings, but we know there are a huge number of elders that are living in the community who have dreams as well. So we are working to establish who those are and establish that, you know, facet of the dreams program. So we would definitely be interested in working with the senior center who has, you know, some members that they would like to, for lack of a better word, enter into the dreams program, to look into doing that. And if you have, we would love to continue a conversation with that. So if you could reach out to us, I have put my email in the chat function. So if you want to go ahead and send me an email that you're interested in a senior center participating in the dreams program, I'll connect you with Amy, and they would love to hear from you and to build that. Because one of the other, you know, programs that we're looking at doing is expanding the dreams program into home delivered meals programs as well.
Yeah.
So right up that alley. Would love to partner with senior centers to do that.
Great.
Yeah. Let me just add to that. We, you know, in the last 2 years, Second Wind Dreams staff and program offerings have basically doubled. So we are growing by leaps and bounds now. And so before we were never able to do these kinds of things. And now we've got a lot of staff, including Sarah and Gwyneth, who have a lot of experience at home and community-based services. And we're trying to really look in all of our programs at more ways to reach all of these different areas. And so go far beyond elder care communities. So possibilities are endless. So if you have an interest, whether it's the Dreams program or something else, please get in touch with us and ask, because we'd love to consider it and look at, you know, the more ways we can partner and collaborate on things, the better.
Yeah, for sure. So I did the virtual dementia tour during my master's program. And so we had, I'm pretty sure we just did the traditional one because we didn't go back in a second time to do that empathy bit, but we definitely talked about that a lot after we finished. I was in a master's of social work program. And I've been encouraging some of the sites that I've been working with locally to do the community-based one. Actually, Milan, the town that I'm in, we were gonna try to do one this past July. Obviously, that couldn't happen. What would be the cost for senior centers? I know there's probably a range, but what is that general cost if a senior center wanted to run one of these virtual dementia tours for their community?
So it depends on how you do it. If you get the program, become a member with us, and have the training and facilitators yourself, then there's different tiers. You know, if you have
yeah. So actually, you're kind of touching on my next question too. So I'll ask that right now.
Okay.
You've mentioned trainers, facilitators, program holders, and members. And so if you could explain some of those differences, that might help with the pricing.
That would help a lot. Jump in my brain and guess what I mean. So a program holder is somebody who, they're kind of synonymous terms. So somebody can be a member. If somebody is a member, an organization is a member, that means that they're either a member of our Dreams program or a virtual dementia tour, or they purchased a virtual dementia tour. So then they have a membership, and that comes with ongoing support and resources and so on. So a program holder is somebody who has purchased the virtual dementia tour, so they're a member. So it's really the same kind of term. What were the other terms?
Facilitator and trainer.
Okay. Yeah. So a certified facilitator is somebody, when you purchase the virtual dementia tour, you get facilitator training for 2 people for each edition of the set of materials. And the facilitator is trained to lead those debriefs and to lead the virtual dementia tour. And then they can use volunteers and whoever they train to help them conduct the tour, but they need to be in charge of that tour. A certified trainer is a higher level. So that they can provide training to facilitators, because we've got so many people. So certified trainers will often do the facilitator training. They can do things that facilitators cannot. They can do the virtual dementia tour at conferences, large meetings. And they can help us with program development, different protocols, and things like that, and a variety of other things. So they can charge for it. A facilitator, regular program holder facilitator, cannot charge for the tour. So if you've got the program, to get back to your first question, if the senior center purchases the program and they offer it to the community, they don't charge anyone in the community. They just can do it as much as they want, free of charge. Anybody, whether you're a certified trainer or facilitator, anybody who has the VDT, if you're doing the community version for the public, you never charge. There's no cost. If you want to do it, for it to provide training to another group, you need to have a certified trainer, and that's where there can be costs coming in there. So it gets a little bit complicated, and so the best thing is to contact us, and our program advisors can help sort out, what's the best fit. The other option is if organizations can't afford to buy the materials themselves to conduct the tour and have a facilitator, you can have somebody else come in and do it for you, for the public. It can be an external program user. More likely it's going to be a certified trainer. With the certified trainers, there is a cost. They charge for it. So, but if you're doing it for the public, they may choose to donate their time. It just sort of depends on the situation. But there's never, ever a cost for people to participate, to go through the tour, ever, no matter what setup we have. So for those participating and taking the tour, that's always free. So there's different ways to make.
And there's one of the other things too is we have program holders, members, those we do use those interchangeably across the country, all over the place. So one of the other things we can do is if someone's interested in experiencing the virtual dementia tour before they go down the road of purchasing and looking to become a member, you can contact us and we can put you in conversation and connection with a local organization that is a member, and they tend to open them to the public, and or if they have an individual who's like, hey, I'm interested in experiencing this, they may open their doors literally to let you come in and experience it one time, and then from there, that way you can experience it yourself before going down a purchasing route. So that is always an option as well, and that's something we can build those connections in different areas throughout the country.
Great. So the options are have a certified trainer come into our centers and run the program for our members and for our community, or we can become a program holder, a member, and be facilitating these by ourselves.
Yeah. And the third option is, if you're doing it just for the public and not for your own staff, somebody who does have the program but is not a certified trainer can come in and host it. You can be the host and do it for the public, okay. And they can do it, but they can only do it one time in any given place. But we can find ways to make it work depending on what your needs are and your budgets are. So
cool.
We don't ever want it to be a showstopper. So if there's ever concern about how to make it happen, just get in touch with us. Just call that number or go to our website. You can fill in a message thing and we'll work with you and figure out how to make it happen.
Great. Let's see my notes. I also like that you use the term care partner. That's something that I've really been pushing within our community to talk about care partners and having that partnership. We did a care partner mapping exercise and all of that. So it was just nice to hear you guys say that too. And that certification as a dementia interpreter sounded super interesting. Is there a mailing list that people can get on so they can be alerted when this is open to the public?
There's a pseudo mailing list. If you email me and I put my email address in the chat function and let me know you're interested, I have a spreadsheet of the people who have said they're interested. As we receive more information, put more out that they want more of that, I will add you to that list.
Mm-hmm. The other option too is not as specific for dementia interpreters, is that we have a general newsletter for anybody who's interested, and you can just go to our website and sign up for it, and then you'll get a monthly email. And For all our program holders, we have a newsletter that's a little bit more clinical oriented, and we'll be advertising that with other things as well, with other supportive content in that as well. So anybody who has the program will get that in another newsletter as well. So I would encourage you to sign up for the general newsletter, because it's got information about what's going on with our Dreams program, our Gifts programs, our VDTs, and all kinds of good things. So, and you can also follow us. That's the other thing I should have mentioned, is follow us on social media. We're on Facebook, Instagram, Twitter, LinkedIn. I don't know if there's any others, but those are the biggies. But we would love to have you follow us there, and all kinds of good intel there too. So, and also, YouTube. We have a YouTube channel. So if you look up Second Wind Dreams and look at our YouTube channel, you can, if you need a cathartic experience, you want to just go lock yourself in a room, get a box of Kleenex, and have nobody see you, and just get out all the stuff you need to get out. You can watch some of our Dreams videos from over the years, or our VDT videos, and I guarantee some of them will make you cry happy tears. Some of them will make you a little bit sad. Most of them, it's happiness, but it's some very moving things. So when you got nothing else to do, and you want a good ugly cry, good happy ugly cry. I encourage you to go there, but there's also some good informational, some good lecture content on there as well. Some short videos for caregivers, just like little 5 minutes or less, or some of them are 2 minute long. Little things like caregiver tips or whatever. You can always, anything that's on that channel, you're welcome to share with others. That's public, content. Okay. So, yeah.
One last question from me. So there's this movement of having dementia-friendly communities. And it sounds like a lot of the services and trainings that you offer can help sites get to that point. Do you have anything else to add around that?
Yeah, we have some of our certified trainers they work for agencies. Like we have one trainer in Wyoming who is, I can't remember the exact title, basically in charge of program content for Dementia Friendly Wyoming. And she uses the VDT among other tools in that training. We have several other trainers and facilitators across the country who are involved either in the network or work for dementia friendly organizations in their state or their towns or whatever. So it's a real good natural fit as one of the VDT is a good tool as part of that. And a lot of them use that with the communities, with not just care partners, but anybody who comes in contact with an elder or with people with special needs populations really should take the tour. So we encourage other folks like everything from a bank teller, first responder, grocery store clerks, any kind of cashier, any kind of person who delivers anything to the home, whether it's a home delivered meal or the mail or whatever, because they're all coming in contact with older adults and a lot of times people with dementia. So they use the VDT as one of the pieces, and a lot of places, a lot of organizations use it as sort of like that base training, because once you open people's eyes to what they're experiencing, then they're much more open to any other additional trainings about dementia. So it pairs nicely with other dementia care types of interventions and approaches as well. But yeah, dementia friendly, we don't have a formal certification relationship with them, but is used quite a bit with dementia friendly programs.
Great. Well, do you guys have any other closing comments as we get close to our hour mark?
The only thing I have is just if you have questions, our information is here and in the chat, so please reach out. We're pretty responsive. We are very passionate about what we do. And if you're interested in obtaining the VDT, whether it's just to be partnered with another organization to experience it or to look into it for purchasing it for yourself, please let us know. And if you reach out to me and let me know that you participated in the WizeCove presentation and looked into it, we are looking at a discount for our participants from WizeCove to purchase the VDT. So just mention that in your email.
Wonderful. Thank you so much, you guys. Thank you. This was really enlightening, and I love the work that you do. Thank you. And thank you.
Yeah.
Our pleasure. I added my email there too if you need it. If you have any questions about the virtual dementia tour or dementia in general, anything like that, please feel free to contact me. If it's a business question, take it to Sarah. If it's content question, you can bring it to me. So thank you all.
All right,
Appreciate your time.
Thank you for having us.
Bye.
Bye. Thank you.
Bye-bye.